Hello. Have you ever woken up in the morning and felt like your legs were heavy and not as flexible as before? You step out of bed feeling numb, weak, or even a little shaky when standing up. If this happens regularly, it is not only a sign of aging, but can be an early warning from the body that you are lacking some important micronutrients, especially those that need to be supplemented before going to bed. Many people think that breakfast is the most important time to supplement vitamins. But what few people tell you is, some vitamins are most effective when absorbed at night, while the body is resting and recovering. Especially for the legs, the part that bears the load of the entire body, the process of muscle regeneration, nerve recovery, and blood circulation mainly takes place at night. According to statistics from the U.S. Centers for Disease Control and Prevention, up to 35% of people aged 60 and older have difficulty walking, standing for long periods of time, or climbing stairs. The cause is not only age, but also the following three silent factors: loss of leg muscle mass due to aging, decreased peripheral nerve conduction, causing leg weakness, loss of sensation, or loss of balance, poor blood circulation in the lower limbs, causing cold feet, numbness, and pain at night. The good news is, science has shown that 3 types of vitamins can significantly improve this condition if used properly, especially if taken in the evening, right before going to bed. Next, we will delve into the first vitamin, which most seniors are lacking and do not realize. But just supplementing properly every night will significantly improve leg muscle strength, balance, and reduce pain at night. Vitamin D, the silent friend of your legs after 60 years old. If there is one vitamin you cannot do without to maintain leg strength after the age of 60, it is vitamin D. But the irony is, the majority of seniors in the U.S. are severely deficient in vitamin D. And many do not know it until they suffer from broken bones, muscle loss, or unexpected falls. Vitamin D deficiency, a silent but dangerous problem. According to statistics from the U.S. National Institutes of Health, up to 76% of people over 60 have suboptimal vitamin D levels. This is extremely serious because vitamin D is key to calcium absorption. If lacking, leg bones are weak and prone to pain. It helps maintain muscle mass, especially in the calves, thighs, and buttocks, helping to stand firmly and walk safely. It plays a role in neuromuscular function, which means helping signals from the brain to the legs to be transmitted smoothly. Without enough vitamin D, you are prone to shaking legs when getting up from a chair, difficulty climbing stairs, calf pain at night, especially in cold weather, easily losing balance when walking on uneven surfaces. Why is it easy to be deficient in vitamin D after age 60? Even though you still eat a full diet? Many people think that drinking milk is enough calcium and vitamin D, but in reality, it is not that simple. The skin of older people synthesizes less vitamin D from sunlight. The skin's ability to produce vitamin D decreases by more than 50% after age 60. Diet lacking in foods rich in vitamin D. Older people often avoid fat, eat less fatty fish such as salmon, mackerel, eggs, and fish liver. The kidneys function less well, causing the body's vitamin D metabolism to decline. Medication. Some medications such as corticosteroids, diuretics, anticonvulsants, or diabetes medications can reduce vitamin D absorption. Therefore, even if you go out in the sun or eat normally, your body can still be seriously deficient, especially in winter or if you live in a cold climate. Why should you take vitamin D at night before going to bed? There is a fact that few doctors emphasize. The time of taking vitamin D has a significant impact on absorption efficiency and muscle recovery effects. Many recent studies, especially from the University of Sao Paulo and the Cambridge Nutrition Institute, have shown that vitamin D is better absorbed when taken with dinner or before bed, especially if that meal contains a little good fat, such as olive oil or avocado. When the body rests in deep sleep, Vitamin D is better converted into its active form, helping to optimize calcium absorption and muscle tissue recovery. A trial of 120 elderly people in Florida showed that the group taking vitamin D3 before bed had significant improvements in lower limb strength, the ability to stand up from a chair and walk for 6 minutes after 10 weeks, compared to the group taking it in the morning. Which type of vitamin D should I take? How much? And how should I take it? This is a question that many people over 60 are interested in, and it is also very easy to be misled by advertising sources. 1. The best form of vitamin D. Vitamin D3 is the most natural, easily absorbed and used form for the elderly. Avoid taking vitamin D2 without a specific prescription from your doctor. 2. Safe and effective dosage. For people 60 years of age and older, a maintenance dose of 800 to 2,000 IU per day is appropriate and safe. If you have been diagnosed with vitamin D deficiency, your doctor may prescribe a higher dose for the first 6 to 8 weeks, then switch to a maintenance dose. 3. Optimal usage. Take immediately after dinner, preferably about 1 hour before bedtime. Take with good fats such as fish oil, avocado, or a spoonful of olive oil. If you are taking medication for a chronic disease, consult your doctor to avoid adverse interactions. Who especially needs vitamin D at night? Older adults who live indoors and have little exposure to sunlight. People with joint pain, weak leg muscles, or frequent falls. People with a history of osteoporosis, diabetes, or chronic kidney disease. People taking diuretics, statins, muscle relaxants, or corticosteroids. If you fall into this group, taking vitamin D before bed each night can be a simple but important step to protect the strength and stability of your legs. Signs that you are starting to recover after taking vitamin D supplements. You won't feel the change right away for 1 to 2 days, but after about 3 to 4 weeks, if your body responds well, you may notice a lighter feeling in your calves in the morning, less pain when standing for a long time or walking, easier to climb stairs, no more leg shaking, less numbness in your legs at night, deeper sleep. These signs are evidence that the muscles and nerves of the legs are recovering. In short, vitamin D is not only a bone vitamin, but also a silent protector of the leg muscles after the age of 60. If you are looking for a simple habit to improve your ability to walk, maintain balance, and avoid falls, then supplementing with vitamin D3 every night is something you should not ignore. Vitamin B, the second brain of the feet. Have you ever felt a tingling numbness in the soles of your feet, like being pricked by needles when lying down to rest? Or sometimes feel like your legs are not listening, want to walk but are not steady, or have a temporary loss of sensation? These may sound small, but they are signs of a very serious problem. Impaired nerve conduction in the lower limbs. And the silent culprit is often a lack of B vitamins, especially B1, B6, and B12. While vitamin D supports bones and muscles, B vitamins are essential for the peripheral nervous system, which controls the movement, sensation, and reflexes of the legs. That's why people call vitamin B the second brain of the legs. Vitamin B deficiency leads to weak legs, numbness, and loss of balance. After the age of 60, the body begins to absorb vitamins less well, especially B vitamins, which are water-soluble and easily excreted through urine. Of these, the 3 most important types for the legs are vitamin B1, necessary for energy production in muscle cells, helps transmit signals from the central nervous system to the legs. Deficiency of B1 causes weak legs, not enough strength when walking. Vitamin B6 participates in the synthesis of neurotransmitters, such as serotonin and dopamine, helps prevent stiffness, cramps, and increases muscle control. Vitamin B12 creates a sheath for nerves. Deficiency of B12 causes nerve signals to slow or distort, causing loss of sensation in the feet and loss of balance. According to a report from Harvard Medical School, about 15 to 20% of people over 60 have low B12 levels that cause nerve damage, and most do not detect it until symptoms such as numbness in the legs, burning sensation, or unsteadiness appear. Why should you supplement vitamin B before going to bed? You may wonder, I still take vitamin B every morning. Why are my legs still weak? The answer may lie in the timing of supplementation. Nighttime is when the nervous system goes into a recovery mode, like maintaining the body's electrical wiring. This is when nerve fibers are repaired and regenerated. Neurotransmitters are regulated, helping to reduce nervous stress. Anti-inflammatory processes in peripheral nerves are activated. A study at the Tokyo Institute of Geriatrics found that older adults who took B-complex vitamins at night had deeper sleep, less numbness in their legs while sleeping, and significantly improved their balance after 6 weeks. You don't need a blood test to know if you're deficient in B vitamins. See if you have the following signs: frequent cramps at night, feeling like your feet are wrapped in thick fabric, losing sensation when walking, numbness or burning pain in the soles of your feet, especially when you first lie down in bed, frequent falls because you have trouble feeling the floor or the edge of stairs, feeling like your legs no longer belong to you, slow to react or inflexible. If you experience 2 or more of the above symptoms, it is likely that you are deficient in B1, B6, or B12 to the extent that it affects leg function, and this is the time to supplement promptly and properly. How to supplement vitamin B correctly and effectively. It is not true that taking more vitamin B is better. Here's the correct way to use it. 1. Choose an easily absorbed form. For the elderly, it is recommended to use methylcobalamin for B12. The B-complex form with a balanced ratio of B1, B6, B12 is ideal. 2. Safe dosage. B1, 50 to 100 milligrams per day. B6, no more than 100 milligrams per day. B12, 500 to 1,000 mcg day is common, can be increased depending on the deficiency. 3. When to use. Use after dinner or right before bed. Can be used alone or in a synthetic B-complex form. Do not use at the same time with strong stomach acid drugs or metformin because they reduce B12 absorption. 4. Combine with supporting foods. Eat a little sunflower seeds, salmon, boiled eggs, or green leafy vegetables to increase absorption efficiency. Avoid drinking coffee, strong tea, or alcohol, which deplete B vitamins. In cases where special attention should be paid to supplementing B vitamins before bed. People with a history of type 2 diabetes. Metformin can cause B12 depletion. People who have used drugs to inhibit gastric acid secretion for a long time. People who are vegetarians or have been on a long-term diet. People who have had peripheral nerve damage or have had shingles in the legs. People often suffer from insomnia, nervous tension, or mild depression. Benefits noticed after 2 to 4 weeks of using vitamin B properly. Reduces tingling and numbness in the feet when lying down to sleep. Feet seem more sensitive when walking, no longer feel vague in the feet. Improves balance, especially when waking up in the morning. Walk more confidently, no longer afraid of falling due to loss of feeling in the feet. Last note, do not combine randomly. Some people buy all kinds of B1, B6, B12 pills and take them at the same time, hoping for faster results. But high doses that are not correct can cause neurological disorders, especially with vitamin B6. The best choice is to use a high-quality B-complex, specialized for people over 60 years old, with a safe dose that has been studied, or ask your doctor if you have many underlying diseases. Vitamin E, the savior of blood circulation in the legs. Have you ever lain down in bed and felt your legs cold, or like a sharp pain from your calves down to your feet? Even when covered with a blanket, it is still cold, or a slight throbbing pain at night. This is not due to the weather, but is often a manifestation of poor blood circulation in the lower limbs. And one of the effective assistants to improve this condition is vitamin E. Vitamin E is a fat-soluble antioxidant that plays an important role in protecting blood vessel walls, preventing blood clots, and improving blood circulation to the lower limbs, especially during sleep. After the age of 60, the circulatory system often slows down, and proper vitamin E supplementation can open up a way to life for the legs. Why are people over 60 prone to poor blood circulation in the legs? The body after age 60 undergoes many changes that affect blood flow to the legs, such as atherosclerosis. Cholesterol accumulates in the blood vessel walls, causing the lumen to narrow. Venous insufficiency of the lower extremities. The valves in the veins do not function properly, making it difficult for blood to return to the heart. Thick blood, high viscosity, due to lack of exercise, mild dehydration, or lipid disorders. Decreased contractility of the heart and peripheral capillaries. As a result, blood circulates more slowly, especially at night when lying still for a long time, causing the legs to feel cold, numb, heavy, or even intermittent pain. If prolonged, this condition also reduces nutrition to the leg muscle tissue, causing gradual muscle atrophy over time. Vitamin E has been shown to have many positive effects on the circulatory system in the elderly. Helps blood circulate more smoothly by preventing abnormal platelet aggregation. Anti-inflammatory of blood vessels, protecting the endothelium, the inner wall of blood vessels. Prevents the oxidation of LDL cholesterol, thereby slowing down atherosclerosis. Increases the elasticity of red blood cells, helping them move easily through the small capillaries in the feet. Research at Harvard University shows that people over 65 years old who supplemented with vitamin E daily had 19% better circulation in the lower extremities and 27% less pain at night than those who did not. Why should you take vitamin E at night before going to bed? Vitamin E is fat-soluble and needs time to be absorbed effectively. Taking it at night has 3 clear benefits. Optimal absorption. When taking vitamin E after a fatty dinner, the body absorbs much more than when taking it on an empty stomach. Promote anti-inflammatory effects at night. When you sleep, the body focuses on repairing cells and regulating the immune system. The ideal time for vitamin E to fight inflammation and improve blood vessels. Support blood circulation when lying down. At night, blood flow to the legs is most likely to slow down. Supplementing vitamin E helps improve circulation at this important time. Signs that you need vitamin E supplementation. Many people do not realize that they are deficient in vitamin E because there are no obvious initial signs. However, if you have the following symptoms, pay special attention. Cold feet at night. Need to wear socks or cover yourself with a thick blanket to sleep easily. Feet numbness intermittently, feeling like ants crawling or being slightly pricked by needles. Slight swelling of the ankles or feet at the end of the day. Easily stiff calves when sleeping, even if you have not exercised much before. Wounds on the legs take a long time to heal or often bruise slightly when lightly touched. If you notice 2 to 3 of the above signs repeatedly, there is a possibility that your circulatory system is having problems, and proper vitamin E supplementation can bring about positive changes. However, not all vitamin E is the same. Here are some tips for choosing the right type and using it safely. 1. Choose the natural form of vitamin E. D-alpha tocopherol is the natural form, with high bioavailability. Avoid using D-alpha tocopherol because it is less well absorbed and can easily accumulate when used for a long time. 2. Reasonable dosage. 200 to 400 IU per day is considered safe and effective for people over 60 years old. Do not use doses above 800 IU per day without medical advice. 3. Optimal usage. Take after dinner, ideally about 1 hour before going to bed. Should be used in combination with foods containing good fats such as olive oil, fatty fish, not butters. If you are taking anticoagulants such as warfarin, aspirin, consult your doctor. While vitamin E can help with circulation, the best results come when combined with the following habits. Maintain light activity every day, such as walking for 20 to 30 minutes or doing leg stretches before bed. Elevate your feet above your heart for 10 minutes every night to help blood return. Gently massage your feet and calves before bed to stimulate circulation. The benefits you will feel after 3 to 4 weeks of regular vitamin E use are warmer feet at night, better sleep, reduced leg numbness, reduced calf stiffness while sleeping, walk more easily in the morning, no longer feeling heavy in the legs, reduce mild swelling in the ankles after a day of standing or walking a lot. In summary, vitamin E is a silent vitamin, but plays an extremely important role in nourishing blood vessels and improving blood circulation in the legs. Using it properly before bed can help you keep your feet warm, flexible, and healthier every day. The 3-week roadmap to restore leg strength after 60 years old. Here is a detailed, scientific, simple plan that you can start tonight. No equipment, no heavy exercises, no complications. Week 1. Activate. Start gently. Goal. Start supplementing vitamins properly, awakening the nervous system, blood vessels, muscles. Supplement 3 types of vitamins immediately in the evening. Vitamin D3, 1000 IU after dinner. Vitamin B complex, type with enough B1, B6, and B12. Vitamin E, 200 IU, taken 1 hour before bed. Elevate your feet for 10 minutes every night. Place your feet on a thick pillow or the edge of the bed to help blood flow back to the heart. Gently massage the soles of your feet for 5 minutes. Use your hands or a small ball to roll from heel to toe, increasing blood circulation. Take notes on how you feel every morning. Do your feet feel lighter, less numb, less cold? Tip: take a photo of your feet on the first morning, so that after 3 weeks, you can clearly compare changes in skin color, swelling, or sensation. Week 2. Strengthen, support nerve conduction, and leg muscle recovery. Goal: increase leg control, reduce numbness, improve reflexes. Continue to supplement vitamins every night without interruption. Take it on time, with dinner is best. Practice sitting, standing, sitting 10 times every night. Sit on a sturdy chair, stand up slowly without using your hands. Repeat 10 times continuously. This exercise helps increase blood circulation in the thighs, knees, and calves. Try a 5 to 10 minute walk at the end of the day. Simply walking around the house, around the yard, or walking slowly in the living room helps maintain leg muscles and keep nerves active. Notes on sleep quality and leg numbness at night. Is it less? Is there more uninterrupted sleep? Week 3. Speed up. Feel the obvious change. Goal: increase leg endurance, restore foot sensation, and move with confidence. Continue taking vitamins regularly. This is the stable absorption phase, so the effect will be more obvious. Add heel lifts, balance. Stand near the kitchen counter or wall for support if needed. Stand on your toes. Hold for 5 seconds, then lower. Repeat 15 times every night. This exercise activates the nerves in the feet, helping to improve sensation and flexibility. Compare with the first week. Do you still have cramps in the middle of the night? Do you get up from a chair more easily? Are your feet still numb when they hit the floor in the morning? If you answered yes to 2 to 3 of the above questions, congratulations, you are on the right track to regaining your leg strength. Common questions from people over 60. I am taking blood pressure medication. Can I take these 3 vitamins? Yes, but you should take them at least 1 to 2 hours apart from your main medication and consult your doctor if you are taking blood thinners. Is long-term use of vitamins harmful to your liver and kidneys? If you take the right dose Choose a quality product and do not overdose. Vitamins D, B, and E are completely safe to take daily, especially when combined with meals. I did not feel any difference after 5 to 7 days. Should I stop? No. It takes at least 2 to 3 weeks for nerve and muscle recovery to see a difference. Consistency is key. In just 3 weeks, with a simple routine, you can regain the strength, flexibility, and stability of your legs. Share this video with your loved ones, because you may be helping them live many precious years. See you in the next videos, where aging health is no longer a mystery, but a proactive, powerful, and worthwhile journey.